You inhale oxygen, which all cells need. Then you exhale a waste gas called carbon dioxide. This gas exchange happens inside tiny air sacs in your lungs. Lung cancer is a disease in which normal lung cells change into harmful, abnormal cells called cancer cells. Cancer cells multiply to form clusters called tumors. These tumors grow and destroy healthy lung tissue. Lung cancer may spread to other parts of your body through blood or lymph fluid, a natural substance that helps gather unwanted waste material from your body. There are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. They are named for the kinds of cells in the cancer and how they look under a microscope. Non-small cell lung cancer is the most common type of lung cancer. Small cell lung cancer is the most aggressive type of lung cancer. It grows and spreads more quickly. The most important risk factor for lung cancer is smoking. Other risk factors include breathing secondhand smoke, exposure to radon, having a family history of lung cancer, HIV infection, exposure to harmful chemicals such as asbestos, and air pollution. Lung cancer may have no symptoms in its early stages. When symptoms do appear, they may include chronic cough, chest pain, trouble breathing, coughing up blood, hoarseness, loss of appetite. A grade and stage might. Only 30% of renal cancers are diagnosed on symptoms. Visible signs are uncommon and usually indicate advanced disease. 17% of patients have metastases at presentation. Imaging in renal cancer is used to stage disease and plan treatment. Radical nephrectomy was historically the standard of care. However, advances in surgical technology have led to increased use of conservative techniques. Nephron-sparing surgery is now recommended as the treatment of choice where possible. The approach depends on tumor characteristics and surgical expertise. Minimally invasive techniques are increasingly used, although data on long-term cancer control are less well established. Patients with metastatic renal cancer are treated with cytoreductive nephrectomy. Historically, systemic immune modulators were used with modest results. The development of targeted biological drugs has been the main advance in the last decade. Active surveillance is also increasing for small incidental tumors diagnosed in the elderly. In the near future, we expect biomarkers, advances in surgical techniques, and systemic therapies to improve cancer control.
Has many functions. It filters waste and other harmful materials from the blood. It produces enzymes and bile that help with digestion. And it produces chemicals and hormones necessary for regulating many body functions. Liver cells are called hepatocytes. Liver cancer is classified as either primary, starting in the liver, or secondary, spreading to the liver from cancer in another part of the body. Hepatocellular carcinoma is the most common form of primary liver cancer. It develops in the liver cells and damages other healthy liver cells. Continuous growth of cancerous hepatocytes can cause malignant or cancerous tumors to form. In its early stages, liver cancer does not produce many symptoms and is hard to detect. As the cancer grows, symptoms such as abdominal pain and bloating, weight loss, nausea, vomiting, fatigue, and jaundice or yellowing of the skin.
What is blood cancer? Blood flows through our vessels to supply all the body's organs and tissues with nutrients. In the roughly 5 liters of blood circulating through our bodies, there are billions of blood cells with different functions that are vital to life. There are 3 types of blood cells. The red blood cells, or erythrocytes, are the most numerous of the 3. They carry oxygen to the body's cells. The white blood cells, or leukocytes, combat diseases. And the platelets, also called thrombocytes, help the body to stop bleeding when injured. The blood cells are formed in the bone marrow. The bone marrow is found in the cavities of bones, for example, in the thigh bones or pelvic bone. One of the body's key defense mechanisms is the natural death of cells. Blood cells that are unusable or damaged initiate pre-programmed cell death, and in this way protect the body from diseases. This is why the body must produce many hundreds of billions of new blood cells every day. All blood cells originate from stem cells. Stem cells. The stem cells are so-called mother cells that have not yet taken on a special function. They are able to renew themselves and to develop into specialized cells. In this way, they can replace the body's dead cells. The stem cells of the blood divide and develop in the bone marrow into progenitor cells. Through further cell division, these progenitor cells then mature into different types of blood cells and enter the bloodstream. How blood cancer develops. Defects can stop the normal process of maturation and natural cell death. This leads to the formation of immature or dysfunctional blood cells, which enter the bloodstream and multiply uncontrollably.